New evidence finds the nation's deadly opioid epidemic is worsening. A report from the CDC shows a nearly 30% jump in emergency room visits for opioid overdoses in a 15-month period. The increases were seen among both men and women and for all age groups. Rates went up in every region of the country. In 2 states, Wisconsin and Delaware, the numbers more than doubled. Our Dr. Tara Narula is here. Good morning.
Good morning.
You know, we just heard in October the Trump administration essentially declaring the opioid epidemic a public health emergency. But this CDC report suggests it's only getting worse.
We are so far from beginning to make a dent in tackling this crisis. When you hear these numbers, 140,000 overdoses, the 40,000 people who died in 2016, as you mentioned, all ages, both genders, every part of this country. So for anyone who thinks that this will not touch them or someone they love, they are wrong. In fact, the Surgeon General yesterday very candidly talked about how his own brother struggles with addiction. So we need more funding for this. We need a multifaceted approach that involves community, the medical profession, government, law enforcement, and individuals.
The CDC says that doctors are prescribing less of these painkillers. So why is this epidemic continuing?
It's a complex issue, but public health officials are saying that what we think is we're seeing a change in the drug supply, that really what we have now are newer, more illicit, toxic, more potent drugs like fentanyl. And these newer opioids, they can cause a lot of damage very quickly. So we're kind of in this third wave of the epidemic. The first one involved prescription opioids. The second was heroin. And here we are now seeing these illicit, more potent, toxic fentanyl-like pain medications. So it may not be that more people are using, but in fact that a single use of a more deadly drug is what we're seeing.
Does that mean that it then has to be targeted like any other illicit drug? In other words, it's coming from drug dealers, not from doctors' offices?
Exactly. And that's why I said it needs this multifaceted approach.
And we keep hearing that it really is not more effective than less risky drugs, the opioids, when it comes to back pain, hip pain, or knee pain. That
right.
The latest study shows that.
Exactly.
So then what is the point?
Well, I think people need to be aware that if they're given an option for opioids, they should ask to try non-opioid options. It should be used in the lowest dose for the least amount of time possible. And that, you know, according to this study, really was not as effective.
Is it up to the doctors, though, Tara, not to even offer it as an option?
Well, I think the CDC did change their prescribing guidelines. And so doctors are more aware now, and they are being more conscious about not prescribing. But this effort has to come not just in the prescribing end. It has to come, you know, this report yesterday talked about the ER as being a really pivotal place for helping as well. They are on the front lines.
People need to get educated about this. I mean, Gail and I were talking about this morning, and I said, you know, when I had a baby, they prescribed Percocet, and my mom said, no, take a Motrin. You'll be fine with a Motrin.
That's right.
And I was fine.
A lot of it is education for patients, for families. But, you know, as I was saying, in terms of the ER, I mean, this is a point where the ER can make interventions for people who have come in with an overdose and send them to medication-assisted treatment. Get them a prescription for naloxone, the opioid reversal drug. There's a lot more we can do.
Thank you.
All right, Dr. Tara Narula, thanks.